Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. My dear friends, today's topic is very interesting. But before that, let me clear that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, yes, you can definitely WhatsApp on 922-6810-630. My dear friends, today's topic, which is something looking like a heard word, but that is not the what you are talking about. Yogya. It is nothing to do with yoga. I am not talking about yoga. This is the word, Sanskrit word, Yogya. Okay? And this is the word related with the surgery subject or Shalyatantra subject of Ayurveda. You try to understand how that word has been come, because this, in today's era, you can see that after completion of our theoretical knowledge, say for example our BMS course, every year is 1.5 year. Okay, first year BMS, second year BMS, third year BMS, 1.5, 1.5, and 1.5. So totally there will be, yes, 4.5 years. But after that 4.5 years, the students has to work or must work in the hospital to take the practical training of different subjects, especially clinical subjects, internal medicine, surgery, ear, nose, throat problem, gynecological problem, pediatrical problem. So the student has to go to the hospital and learn all the practical training and all the practical, what you can say, the techniques. For example, Panchakarma. Unless and until he completes his practical training, that is called as an internship, for 1 year, he is not getting final certification from the university, and also the not registration at the governmental level, that is MCIM, Medical Council of Indian Medicine. And this is not for Ayurveda. This is for every branch, especially allopathy and homeopathy as well. So this particular internship or practical training has been already mentioned 5,000 years back in the Samhita, that is Sushruta Samhita. So we will try to understand what is mentioned in the Sushruta Samhita regarding this practical training. And the word is Yogya. Yes, it is Yogya and not yoga. So let us see what our Ayurvedic previous scientists, they are expected to learn by the students, that is the Yogya. So Yogya is a clinical practice. In Sushruta Samhita, Sutrasthan, chapter number 9, that is Yoga Sutriyam Adhyaya. What is the chapter name? Adhyaya is a chapter, and chapter name is Yoga Sutriyam Adhyaya. Here, the concept of experimental surgery has been described and named as Yogya. So that the person, the student of medical student, he becomes Yogya in Sanskrit. Authentic person, capable person to go for practice. Yogya is the preparation process of training a surgeon to achieve dexterity and confidence in performing Chedanadi Shastra Karma, and thereby becoming eligible. Eligible is equal to Yogya. Yogya means eligible candidate, eligible doctor, to use this practical knowledge for the benefit of the society, for the benefit of the patients. Even if a person is well read and possesses theoretical knowledge, without becoming Yogya, the person is an incompetent physician. In short, Sushruta has stressed that practical knowledge is equally important like your theoretical knowledge. So theory and practice, they are the two sides of the same coin in the medical field. Remember this. Now, Chedana Yogya. Chedana should be practiced, demonstrated on the models such as the pumpkin gourd, kushmand. Sanskrit words are outside and the parallel English words are inside the bracket. Alabu, that is bottle gourd. Then watermelon, that is kalindaka. And trapusha, that is cucumber. So these are the different fruits by which the medical student can learn the Chedana karma. It is done to learn the proper application of Chedana karma by experiencing required force which is needed to excise the different types of tissues with different surfaces and different resistance. Because you can see pumpkin gourd, when you want to Chedana, penetrate, then bottle gourd, the different force is required because their surfaces are having the different density. Then excessive cutting, that is utkartana, and inadequate cutting, apakartana, can be demonstrated by using these particular fruits. So fruits are the role model for doing the practice of Chedana karma. Now this Chedana, Vedana, all these Ashtavidha karmas, I have already uploaded the video about this Ashtavidha karma mentioned in Sushruta Samhita. So before this, you can see that particular different karmas and you will understand what does mean by Chedana karma. Now, Vedana karma. Vedana should be demonstrated and practiced on the models like urinary bladder of animals or leather bag filled with water or various other substances having the different consistency. It is done to learn the proper application of Vedana karma by experiencing the incision method or the materials with different wall tension and content. Wall tension is different and content is different when you are using urinary bladder or animals of the either urinary bladder or the leather bag filled with the water. So this is Vedana karma. Next is Lekhana Yogya. Lekhana karma, eligible candidate. Lekhana should be demonstrated and practiced on a broad sheet of animal leather with hair. Animal leather with hair. This is done to learn the proper application of Lekhana karma by experiencing the use of surgical instrument in order to adequately balance it to avoid the injury of underlying structures. So Lekhana Yogya should be practiced. Model is broad sheet of animal leather with hair. Now, Vedana Yogya, Vyadhana Yogya. Vyadhana should be demonstrated and practiced on the models like vessels of dead animals or lotus stem. It is done to learn the proper application of Vyadhana karma to gain the dexterity in piercing a structure adequately. Vyadhana Yogya. Then Eshana. Eshana should be demonstrated and practiced by using different holes eaten by the moths in pieces of wood, bamboo, dried bottle gourd. It is done to learn the proper application of Eshana karma to be able to identify the nature of the foreign body inside a structure in terms of size, number, and fixity. So this is Eshana Yogya, eligible for doing the Eshana karma in surgery. Aharana Yogya. Aharana should be demonstrated and practiced by using models such as jackfruit, bimbi, bilvafala majja, and mruta pashu danta, that is teeth of the dead animals. It is done to learn the proper application of Aharana karma to experience the optimum grip and force required to remove a structure while causing minimum damage to the surrounding structure. That is Aharana Yogya, eligible. Visravana Yogya. These are all the Ashtavidha karma mentioned by Sushruta. Visravana should be demonstrated and practiced by using the surface of Shalamali. This is the name of the plant, covered with Madhuchishta. Madhuchishta means bee wax. This is done to learn the proper application of Visravana karma by practicing superficial incision without cutting the deeper than the skin. So this is Visravana Yogya. Sivana Yogya. Sivana, suturing. Suturing should be demonstrated and practiced by using a thin or thick piece of the cloth or the leather. It is done to learn the proper application of Shivana karma by practicing the different suturing methods on the structures with the different thickness. So, Shivana Yogya, this is the practice of Ashtavidha Shastra karma. Next is Bandhana Yogya. Bandhana should be demonstrated and practiced on the models made from mud, cloth, etc. That is called as a mannequin and parts of the human body. It is done to learn the proper application of Bandhana karma by practicing the different bandaging methods with different bandage materials on different locations of the body. Bandaging techniques, Bandhana Yogya. Agni Kshara Yogya. Agni karma and Kshara karma should be demonstrated and practiced on the soft parts of the animal muscle or animal flesh, that is Mamsa. It is done to learn the proper application of Agni karma and Kshara karma by practicing their different methods and to observe the Agni and Kshara Dagdha Lakshanas. Next. Next is very interesting. Another word, Sanskrit word, Vishikhanupraveshana. Vishikhanu process. Vishikhanu process is the process of entering into the medical profession. This is described in Sushruta Samhita, Sutrasthana, chapter 10, Vishikhanupraveshaniyam Adhyaya. Adhyaya is a chapter. What is Vishikha? Vishikha, by word-to-word meaning, is the removal of the tuft of hair on the head, Vishikha, which was maintained as a custom during the period of studentship. When the medical student, when he is doing learning, then he has to make a tuft of, he has to maintain the tuft of hair on the head. But after completing the education, he has to remove it. Traditionally, it was removed upon the completion of the studies. The student should fulfill the following requirements to be eligible for becoming a Vaidya. He or she, boy or the girl, must be well versed with the different tantra, that is theoretical knowledge. The student should be able to properly understand the meaning of what has been studied. The student have observed the various therapies and their effects. The students have been made eligible, that is Yogya, through practical training. Student should be able to recapitulate, that is summarize and state the main aspect of the tantra, that is theoretical knowledge. Students have obtained the permission of the king. Now in these days, you can get the MCRM register, Medical Council of Indian Medicine registration. That is nothing but the permission from the government. Students have cut the nails and shaved the beard. Students should be clean, wear white dress, hold an umbrella and stick, and wear the footwear. Students must maintain a peaceful mind, pleasant speech, and good deeds. Students should remain friendly and helpful towards all the living beings. Students have trained and capable of assistant to the senior doctors. When examining the patient, the physician should use the Shadavidha Pariksha, that is Panchajnanendriya and the Prashna Pariksha. Prashna Pariksha is the interrogation or the history taking. And what we do, the Pratyaksha Pariksha, by using our stethoscopes, by using the inspection, palpation, percussion, and auscultation with our different organs. So, my dear friends, this is in short regarding the Yogya and Vishikhanupraveshana. This type of questions are always asked in the Shalyatantra subject or surgery subject of the last professional course of BAMS. So, my dear friends, thank you very much. Please like this video, share this video, and don't forget to subscribe my channel, because I get the energy from your compliments and for your comments. Thank you very much. Take care, and I wish you all the best for your study purpose. Thank you. Thanks a lot.